Hi, my name is Dr. Daniel Swan, and I'm one of the professional services veterinarians with IDEXX Laboratories. I wanted to talk to you briefly about C-reactive protein in our canine patients and how we can use it in everyday clinical practice. So C-reactive protein is an acute phase protein, which is produced in the liver in response to systemic inflammation. Now, systemic inflammation is when we have a severe enough inflammatory response that cytokines from that area spill over into systemic circulation. They make their way to the liver, and those cytokines induce the production of what's called acute phase proteins. And one of those acute phase proteins is C-reactive protein. So the great thing about C-reactive protein is that we can pick it up on our blood tests within 4 to 6 hours after the initial stimulus. It also has a really short half-life. So we're going to see reductions in our C-reactive proteins within 24 hours after the resolution of that inflammatory response. The 3 ways that I would utilize C-reactive protein in a clinical setting would be in those sick, off-color patients. They're just not right. We can't put our finger on what's wrong, and maybe the rest of our diagnostics have been relatively unremarkable. Before sending that patient home, I think it would be a great idea to run a C-reactive protein. If we have an elevation, that's a really great indicator to go further in our diagnostics. The second way that I would use it would be to monitor for post-operative complications. A great example is the dog that's come in after eating a foreign body, and if we trend C-reactive from day 1 to discharge, and at day 3 we see a bit of a spike in our C-reactive, that's a really good indicator that we need to follow that up with some further diagnostics. We may have a mild dehiscence of our enterotomy site. So it helps to give us a heads up for when we need to be worried. The third way that we can use C-reactive protein is to monitor our treatment efficacy. There are actually papered studies that show by utilizing and trending C-reactive protein in patients with diseases like bacterial pneumonia, we can significantly reduce the duration of treatment with those antimicrobials without increasing the cases of relapse. I hope that's been useful in helping to understand how we can utilize C-reactive protein in everyday clinical practice.